Hi, I'm Erin Petersilie, the Kansas Farm Bureau Health Plans Manager, and today let's talk about signing up for Medicare. Enrolling in Medicare can happen in several different ways. First off, for some individuals, it's automatic if you are already receiving your Social Security benefits or your railroad retirement benefits. You won't have to do anything. Your Medicare card will simply come, you can finish picking up rest of the pieces and go on about your business. But for those that are not, you will actually need to have a few steps that you need to take care of. So what you have is an initial enrollment period. And what's going to happen is that is going to be 3 months before you turn 65, the month you turn 65, and then the 3 months following you turning 65. But it can also happen for those that are in the 25th month of their disability benefits. So if you have a Medicare eligible disability, and from your time of your diagnosis of that, you will be eligible for Medicare once you have reached the 25th month. So when you get this, you will get your Medicare card, and you have a couple decisions when that Medicare card arrives. First off, please check your mail, watch it. Many people get very confused by the amount of mail that does come when you are eligible for Medicare. So please take a moment, open it up, check it out what it is. If you need somebody else to help and make sure that you're not throwing it away, we'll give some resources at the end of people that you can reach out to. But with Medicare, it's going to be a card, and honestly, it does look like junk mail, okay? So they're not plastic cards, they're going to be kind of a cardstock type paper, and it's very easy to just mistake it for junk mail. So don't throw anything away, make sure we're opening up our mail. But when you do get your Medicare card, you have a couple of options. So let's say I'm receiving Social Security and my Medicare card is going to come to me automatically. The first thing I'm going to do is I'm going to open it up and make sure that all the information is on it that is correct. But maybe I don't need to take Medicare Part B. Maybe I am still getting benefits either from a retirement group or maybe because my spouse still has health benefits. So I can choose to keep it and accept Medicare Parts A and Part B, or I can return it, sign the back, follow the instructions on the back of the card, and refuse Medicare Part B. So remember, you do not have to be retired to actually sign up for Medicare. And your initial enrollment, like I said earlier, lasts 7 months. 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. And there's other times that you can enroll. Know that with Medicare, there are penalties, okay? And you really need to understand and make sure that you are enrolling at the right time for what works for your situation. So if you have any questions, please reach out and we'll help you, or like I said, I'll give you some resources as well. So you may end up paying a penalty if you delay enrolling, again, depending on your circumstance. So if you are not gathering your Social Security benefits where your enrollment would be automatic, there's some steps that you need to do. So if you're not receiving those, you will need to either go through Social Security, or if you are a railroad retiree, you will go through your board to access those benefits. So to enroll in Social Security, you can visit the local office, you can call for an appointment, but the fastest, easiest way is to actually go online to socialsecurity.gov or ssa.gov and go through that. It's a very, very simple process. It should take about 15 minutes. So nothing that's real difficult there. And then if you are through your railroad retirement, you can either go to your local office or call that phone number on the screen. So initial enrollment period was when you first turned 65, but then we have what's called a special enrollment period. And this is what's going to happen if you choose to delay your Medicare enrollment. So let's say, for example, I turned 65, I am still actively working, I still am being covered by my employer, and I don't really need to take Medicare because why do I need to pay for something if I am getting my health insurance covered for me by my employer? So I'm going to delay my Medicare enrollment. And then what's going to happen is, when I turn 67, 68, whatever the magic age may be for you, and you choose to retire, then you will be granted a special enrollment period for you to be able to go in at no penalty. You'll have to prove that you've had credible coverage and be able to sign up for Medicare. This is also true if you have had a spouse that has had active employment. So maybe at 65, again, I or my spouse is working and I wait, and hey, you know what? It's time for us to retire. We're 67 and it was under my spouse's employment, same thing. I'll prove that I've had credible coverage, and then I can sign up at that point in time. So whichever works for you, that's when you will be granted that special enrollment time. And remember, there won't be any premium penalties that apply. Okay, so we've had our initial enrollment period, we've had a special enrollment period, but what happens if I just ignore enrolling in Medicare altogether? Either I don't want it, I didn't think it was for me, I wasn't ready for it, maybe I've heard lots of excuses. I don't see very many of these, but every once in a while I run across probably one person a year that just didn't want to enroll in Medicare when it was time for them. So when you enroll in Medicare, then you will be given a general enrollment period. So initial was 3 months before you turn 65, the month you turn 65, and the 3 months after you turn 65. Okay, but then I wasn't ready to retire at 65, so maybe I had my special enrollment period, which allowed me 8 months past leaving my employment or my spouse's employment. But I ignored all of those. So then what are my options? And if you ignored all of those, then you have what's called a general enrollment period, where anybody, regardless of their circumstance, regardless of the reason why they didn't enroll in Medicare at the appropriate time, can enroll between January 1st and March 31st. So every year between that time frame. And then that coverage doesn't begin until July 1st. And there will be some penalties for delaying the premium. So there is a formula for being able to figure that out, but it will depend on how long you went, and et cetera, et cetera, et cetera. So if you ignore Medicare, this is your option to be able to enroll. But please don't do that. That's why we're doing some of these educational seminars, is so that you really know the right time and can really be taking proactive steps so that we don't face any of those penalties. So at the beginning, I said, hey guys, there's lots of resources out there, and there truly is. And there are some great resources out there, and they include Medicare.gov. Our Kansas Insurance Commissioner is a wonderful resource. Cannot say enough great things about her. ksinsurance.org is that website. Social Security provides a lot of great information on where you will actually go to enroll in Medicare at ssa.gov. And one of the great resources we have here in the state of Kansas, just because they're located for us in a lot of our communities and a lot of our counties, and that's the Senior Health Insurance Counselors for Kansans, or SHIC. And you can find out more information about where they're located, the resources that they provide at kdads.ks.gov. If you have more questions, please feel free to reach out to us. You can email us at kfbhealthplans@kfb.org. And if you have other questions regarding Medicare or any of our health plans, also check out our website at kfbhealthplans.com. Thank you.